Helen, we've heard a lot over the last few days on various issues and quite a lot around consumer rights and things. I think your presentation was probably one of the most powerful because it touched on a group that could be helped with a lot of these new products, a group that is often forgotten, I think, in the conversation around vaping, etc., and people with mental health issues and other disadvantaged groups. I just wonder, where do you think the potential is to take this forward? Because certainly in the UK, I'm not aware of many people picking that particular issue up yet.
Well, I think in the United States it's going to be a hard road, to be honest, but I have a slogan that I like to say, and it's this: tobacco war over, nicotine wins. And nicotine is going to win. It's here. People derive major benefits from using nicotine, especially when it's divorced from combustible tobacco. And the genie is essentially out of the bottle with the invention of electronic cigarettes. They're not going to go away. They can try to pass regulations and all kinds of rules that limit how people can use it, but I don't believe it can last, because the positive effects of nicotine, in particular for the people that I work with, people who have a psychiatric diagnosis, are really, really enormous. And we're talking about saving lives, right? People throw around the number 480,000 people die every year in the United States due to smoking-related illnesses. About 200,000 of that number are people who have a psychiatric diagnosis. And we have to do something about that. And I believe electronic cigarettes is one of the ways that we can begin to reduce that number of deaths.
Certainly in the UK we have a lot of talk, a phrase, health inequalities is something that's used in local authorities, local public health. But I wonder whether actually the mental health angle might be a way that we might start working that in there, because it's very clear, because the rates of smoking in that group are so high. Have you any ideas about how we can promote that to the professionals though? I'm just wondering how some of my colleagues I know from mental health services in England, I think, would find this quite a reach at the moment. It's not something that I've heard many of them talk about.
Well, it's difficult in the sense that, at least in the United States, people who have a psychiatric diagnosis are very marginalized. And as I said earlier, I feel in many ways it's a population that is invisible to a lot of people, and their lives are disposable. So we're fighting the stigma that people who live with a mental health condition face every day. However, I do believe that people who work with this group of people really do care about them and want them to live longer. And I think that many of them understand that the sort of classic nicotine replacement therapies don't work very well for this group. The patch, the gums, the medications. Many of the people that I work with, they've tried them, and for a whole variety of reasons they don't work. And I think we're going to get to a point in the mental health community, the health provider community, where people are going to say, we've got nothing left to lose. Let's see if this works. It helps that in your country, the Royal College of Medicine, Public Health England, put out that study. More and more studies are showing that they're safe. No, tons of batteries are not exploding. They actually are much safer than combustible tobacco. So I think what happens abroad will help us. I mean, the other challenge we have in the United States is we have a broken healthcare system. And one of the things that would really help is if insurance covered the cost of electronic cigarettes. They cover patches, gums, varenicline, the other medications, and that would be another area that we could look at, because we know insurance companies like to save money. They don't want to pay out. They're profit-based enterprises, and if they got on board with electronic cigarettes, because people aren't going to be getting lung cancer and all kinds of infections and diseases, that might be another way to look at how we can bring electronic cigarettes into the community, people who have a psychiatric diagnosis, who are dying at the highest rates.